Gentlemen, let's begin with a simple truth that too many men ignore until problems arise. Your prostate may be small, but it has a huge impact on your quality of life. For men over 50, this walnut-sized gland deserves attention because when it functions well, you hardly notice it. But when it doesn't, it can quietly disrupt not only your comfort, but also your overall health. So, what exactly is the prostate? In the simplest terms, it's a gland that sits just below your bladder and surrounds part of your urethra, the tube that carries urine out of your body. Its main job is to produce fluid that nourishes and protects sperm. But beyond reproduction, its location and connections to the urinary system mean that any swelling, growth, or imbalance in the prostate can directly affect how you urinate, how your bladder feels, and in some cases, even how your kidneys function. Now, many men think of the prostate only when they hear scary words like cancer. But the truth is, long before cancer ever enters the picture, the prostate is already influencing your day-to-day health. That's why awareness is so important. By understanding what the prostate does and how it changes with age, you give yourself the chance to act early, before small problems become big ones. One of the key things to know is that the prostate is influenced by hormones. Testosterone, the hormone that fuels male energy, muscle strength, and libido, also plays a role in prostate growth. As you age, your testosterone naturally declines, but another form of testosterone, called dihydrotestosterone or DHT, tends to rise inside the prostate. This hormone is a big reason why the gland often gets larger over time. A little enlargement can be harmless, but when it presses too hard on the urethra, you begin to notice symptoms. Slower urine stream, more frequent trips to the bathroom, or that frustrating feeling that you didn't empty your bladder completely. And here's the part many men don't realize. Your heart and prostate health often walk side by side. Studies have found that men with poor circulation, high blood pressure, or high cholesterol are more likely to face prostate problems. Why? Because blood flow, hormones, and inflammation are all connected. When your cardiovascular system struggles, your prostate may also face the impact. This is why looking after your prostate is not just about comfort, it's about protecting your overall vitality. Let's think about this in practical terms. Imagine you're out enjoying a family dinner, and instead of being present with your loved ones, you're distracted because you feel the urge to use the restroom every half hour. Or picture yourself waking up 3 or 4 times at night, unable to get good sleep because your bladder keeps calling. These may sound like small inconveniences at first, but over time they steal energy, weaken your focus, and reduce your joy in everyday life. That's why the prostate matters so much. It's not just a medical issue, it's a quality of life issue. Another hidden truth is that the prostate can influence emotional health. Men rarely talk about it, but frustration, embarrassment, and even anxiety often come in hand with urinary problems. The thought of needing the bathroom quickly or worrying about accidents can make some men withdraw from social events. Over time, this kind of stress can harm your mental well-being, and we know that chronic stress is also harmful to the heart. So once again, the prostate is tied into your whole picture of health, not just physical, but emotional as well. Here's something to keep in mind. Not all prostate changes are dangerous, but they all deserve attention. The earlier you notice changes, the more options you have to manage them. That's why regular checkups with your doctor are so important after 50. A simple exam and sometimes a blood test called PSA can give a lot of information. Too many men avoid these conversations because they feel uncomfortable, but taking charge of this part of your health is one of the strongest steps you can take to stay independent and active. So the bottom line in this first part is clear. Your prostate might be small, but it carries weight in your daily comfort, your hormone balance, your heart health, and even your emotional well-being.
understanding it is the foundation. In the next part, we'll go deeper into the most common prostate changes that men face after 50, the ones that catch you off guard if you're not prepared. We'll also cover the warning signs that you should never ignore. Before we continue, do me a favor. If this message is connecting with you, hit that like button, subscribe to the channel, and share this video with a friend. You never know whose life you might improve just by spreading the word. As we move forward, let's talk about what actually happens to the prostate as men age. After 50, changes in this little gland are almost guaranteed. It's just part of the natural aging process. But not all changes are harmful, and not all of them mean disease. The real key is knowing the difference between what's common and what's concerning. The most frequent condition men face is something called benign prostatic hyperplasia, often shortened to BPH. Benign means it's not cancer, but it still brings challenges. BPH is basically the enlargement of the prostate. Remember how we said earlier that hormones like DHT can cause the prostate to grow? Well, as it gets larger, it begins pressing against the urethra, the tube that drains urine from the bladder. This narrowing explains why men with BPH often notice a weak stream, difficulty starting urination, or the need to strain. Some men even describe it as standing there forever and hardly anything happens. Another sign of BPH is frequency, having to use the restroom more often than before, especially at night. If you find yourself waking up 2, 3, or even 4 times to urinate, that's your prostate sending a signal. Interrupted sleep not only makes you tired, but also puts stress on your heart, because poor rest raises blood pressure and increases strain on your circulation. Next, let's touch on prostatitis. This condition is different from BPH. Prostatitis is inflammation of the prostate, sometimes caused by infection and sometimes not. It can create burning during urination, pain in the pelvic area, or discomfort after sitting too long. For some men, it comes and goes. For others, it lingers and creates ongoing irritation. While prostatitis is not usually life-threatening, it can deeply affect quality of life, causing pain, fatigue, and frustration.
Now, the condition that understandably creates the most concern is prostate cancer. It's one of the most common cancers in men, especially after 50. The good news is that when caught early, it's very treatable. The challenge is that early prostate cancer often causes no symptoms at all. That's why regular screening is so important. But there are warning signs to keep in mind. Trouble urinating, blood in the urine, unexplained pain in the back or hips, and sudden changes in bladder habits that don't improve. None of these automatically mean cancer, but they are signs that should never be ignored. So what's the pattern here? Nearly all prostate problems share one common theme. They affect urination. This is why paying attention to bathroom habits is so important after 50. It's not just an inconvenience, it's your body's early warning system. If you notice changes that persist for weeks or months, that's the moment to talk to your doctor. Let's also address a myth many men believe. If I can live with the symptoms, I don't need to do anything. That's not true. Even benign enlargement, if left unchecked, can eventually damage the bladder and even the kidneys because of back pressure. An untreated prostatitis can lead to repeated infections. Your body may adapt to discomfort, but that doesn't mean the underlying issue is harmless. Something else to consider is how circulation and hormones tie into prostate changes. Men with high blood sugar, high cholesterol, or obesity often face prostate problems earlier and more severely. That's because poor circulation and higher inflammation levels affect how the prostate tissue grows. This is another reason why prostate health is never just about one organ. It's about your whole system working together. Now, if you're listening and wondering, so what should I do if I notice these signs? The answer is simple. Don't wait. Make a list of what you've noticed, when it started, and how it affects your life. Bring that list to your doctor. A straightforward check, sometimes a simple physical exam and a PSA blood test, can give answers and peace of mind. And let's be honest, many men avoid these conversations out of embarrassment. But think of it this way. Having an awkward 5-minute conversation today could save you years of discomfort later. That's not just smart, it's strong. Taking charge of your health shows courage, not weakness. So, to recap this section, after 50, prostate changes are common. BPH causes enlargement and urinary symptoms. Prostatitis creates irritation and pain. And prostate cancer, though often silent at first, becomes more treatable the earlier it's found. Your best defense is awareness, noticing changes early and never ignoring the signals your body gives you. Up next, we'll shift our focus from problems to solutions. What practical steps can you take every day to protect your prostate, keep symptoms under control, and give yourself the best chance of a strong and healthy future? That's where lifestyle, diet, and simple daily habits come into play, and I'll guide you through them step by step. Before we continue, if this video is giving you clarity, please hit that like button, subscribe, and share it with a friend. These are conversations men don't often have, but by sharing, you could be helping another man catch a problem early and live longer, stronger, and healthier.
Now that we've looked at how the prostate works and the common problems men face after 50, let's move to the part that matters most, what you can actually do about it. The good news is this. While you can't stop aging, you can take steps every single day to protect your prostate, reduce your risks, and maintain comfort, strength, and confidence. The first step is regular checkups. I know it's tempting to skip them, but nothing beats early detection. For most men over 50, this means having a prostate exam and a PSA blood test as recommended by your doctor. These tests are quick, and while they may feel a little uncomfortable, the information they provide is priceless. Remember, early detection doesn't just save lives, it also gives you more options and less invasive treatments if something is found. Think of it as maintenance for your body, the same way you would maintain your car or home. Next, let's talk about diet, because what you put on your plate shows up in your prostate. Research has shown that diets high in red meat, processed foods, and unhealthy fats can increase the risk of prostate problems. On the other hand, diets rich in vegetables, fruits, whole grains, and healthy fats can protect the prostate. Foods like tomatoes, which are high in lycopene, have been linked to better prostate health. Cruciferous vegetables like broccoli, cauliflower, and cabbage also help reduce inflammation. Even simple daily choices, like swapping sugary drinks for water or choosing grilled fish instead of fried meat, add up to powerful protection over time. Equally important is physical activity. Exercise doesn't just strengthen your muscles, it improves blood circulation, lowers inflammation, balances hormones, and supports healthy weight. All of these directly reduce strain on the prostate. You don't need to run marathons or lift heavy weights. Brisk walking, cycling, swimming, or light resistance training a few times a week can work wonders. And here's a tip. Consistent activity is more valuable than intense bursts. Aim for movement you enjoy and can stick with long-term. Let's move to hydration, which many men underestimate. Your bladder and prostate are neighbors, and they both depend on healthy fluid balance. Drinking enough water helps flush out the urinary tract, reduces the risk of infection, and makes urination smoother. Dehydration, on the other hand, irritates the bladder and can worsen symptoms. A good rule of thumb is to drink enough so that your urine is light yellow, not dark. But also be mindful of evening fluids. Too much right before bed can lead to those frustrating nighttime trips. Another powerful tool is managing hormones naturally. While testosterone and DHT play roles in prostate changes, lifestyle influences these hormones more than many men realize. Getting enough sleep is one of the simplest ways to support healthy hormone balance. During deep sleep, Your body restores testosterone and repairs tissues. Chronic lack of sleep, on the other hand, raises cortisol, the stress hormone, which puts pressure on your prostate and your heart. Protecting your sleep is protecting your health. Stress management itself is also key. High stress levels don't just affect your mood, they directly impact inflammation and circulation, which influence prostate health. If your main way of handling stress is ignoring it, your body will eventually pay the price. Instead, build daily habits that calm your system. Deep breathing, meditation, prayer, time in nature, or connecting with loved ones. Even 10 minutes a day can lower cortisol and give your prostate a healthier environment. Now, a practical step many men overlook is limiting irritants. Alcohol, caffeine, and spicy foods can worsen urinary symptoms for some men. That doesn't mean you need to give them up completely, but if you notice more bathroom trips after a few beers or too much coffee, it's worth cutting back. Small adjustments here can dramatically improve your comfort. Another point is staying aware of warning signs without living in fear. If you notice changes in urination, blood in the urine, pain, or unexplained fatigue, don't brush it aside. These are not signs of weakness. They're signs your body needs attention. Responding early keeps problems smaller. Finally, let's talk about mindset. Too often, men over 50 start to believe that decline is unavoidable, that discomfort is just part of getting older. That's not true. While aging brings changes, how you respond determines your quality of life. Men who take charge by eating well, moving daily, getting checkups, managing stress, and paying attention to their bodies often live longer, healthier, and happier lives. They stay active with their families, enjoy independence, and keep their confidence intact. Gentlemen, your prostate is not something to fear, it's something to respect. By giving it the care it deserves, you're not just protecting one gland, you're protecting your whole well-being. Think of these steps as an investment. Each small choice today builds toward a future where you can keep doing the things you love with the people you love without being held back by unnecessary discomfort. So, if you found value in this conversation, do me one favor. Hit the like button, subscribe to the channel, and share this video with a friend. You never know whose life you might change by passing this knowledge forward. Stay strong, stay informed, and remember, taking care of your prostate is taking care of your future.